Well, the CDC has issued an urgent health advisory for pregnant women who are not fully vaccinated against COVID-19.
And here to talk about that is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Doctor, thank you so much for joining us. This is obviously a very important topic, and this is all breaking off of what the CDC recommended today. This new warning applies, and correct me if I'm wrong, to women who are pregnant, trying to become pregnant, or just delivered a baby. That's correct?
Yes.
Okay, so what can you tell us about their health risk from COVID?
So the health advisory is due to the fact that there have been 125,000 confirmed cases of COVID-19 in pregnant women, including 22,000 hospitalizations and 161 deaths. And 22 of those deaths were in August alone. Wow. 97% of the hospitalized pregnant women were unvaccinated. And in addition, pregnant women who have COVID are at increased risk for adverse pregnancy outcomes, including stillbirths. Now, I've seen these outcomes firsthand, and they're preventable with vaccination.
Okay, I want to bring up some of the numbers here, what we know about the numbers of who's vaccinated, who's not. Here's a graphic. According to the CDC, just 31% of women in the U.S. were fully vaccinated before or during their pregnancy. A little over 25% were partially vaccinated. So why do you think that number is what it is? It's so low. And how does Massachusetts compare?
Well, I think there are two main reasons. I mean, having been pregnant myself, I can appreciate there's almost an instinct that kicks in that says, I'm not going to put anything foreign in my body. I mean, when I was pregnant the first time, I refused to take antacids for my terrible heartburn, even though my doctor told me to do so. And the second reason is people have heard misinformation about the vaccines and their potential effects on fertility or pregnancy. And I should really call it disinformation, because it's not just wrong, it's purposefully false and designed to spread untruths. And in this case, it's leading to harm to women and their babies.
So just quickly, before we move on to the next question, talk about fertility and give the correct information based on the fact that you're an epidemiologist.
Yeah, in clinical trials, exactly the same number of pregnancies occurred in the vaccine group and the placebo group. And we now have extensive data now that billions of vaccine doses have been given across the world over the course of over a year, if you count the research studies, with no impact whatsoever on fertility or miscarriage. Vaccination is by far safer for pregnant women than taking chances with the virus itself.
So, doctor, let's talk about the side effects from the shots. Are they more common or more severe in pregnant women? I think a lot of people want to know the answer to that.
Nope, the side effects have been reported to be exactly the same.
Okay. Dr. Doron, we thank you so much for your insight. You've given us a lot of perspective here as this is rolling out, and everything changes as it does, and we get more information, and we appreciate your time and your insights.
We do. Thank you, doctor.
Thank you.
Thanks. Stay well.